T4 friends. It is Dr. Alanna Bree coming to you live with a dear friend today, Kelly Barta. And Kelly is a dear, dear friend in many ways. And I'm so excited to be launching this T4 P2 series with her. So the Tots to Teens Tidbits, we are going to start having patient perspective, so P2 webinars every once in a while with the different members of the Coalition of Skin Diseases, the different patient advocacy groups, just to highlight them and the work that they're doing. Hopefully we'll be able to, on these P2, T4 P2 series, we'll be able to highlight a dermatologist who's involved with these organizations. And I will let you know, for anybody watching this, it is so amazing as a dermatologist to be involved as a patient advocate with one of these organizations, and they will all welcome you with open arms onto their scientific advisory councils, their boards of directors, and just a pair of helping hands also for research, just because they really need the help of dermatologists, but we really get more than we give when we work with these amazing organizations. I've had the pleasure of being on the Scientific Advisory Council of the National Foundation for Ectodermal Dysplasias. I got to speak at the Foundation for Ichthyosis, the first foundation in the past, and attend as a panelist. And basal cell nevus syndrome, I've also been involved with the Gorlins Alliance, and been able to do some actually great studies with them that are published in the literature. And with the NFED, I actually applied with Mary Fate, who is the executive director. Her and I applied, and we actually got an NIH grant to support our work for AEC syndrome. And that was pretty amazing. We had an international colloquium and really just got some amazing data out of that that's published in the literature as well. So anyway, I would encourage any dermatologists to get involved with these patient advocacy organizations, as well as the coalition, which is really the collaborative and the collective of all of the patient advocacy organizations that are a part of our coalition. And we are out there representing the 84.5 million people with skin disease. And I will tell you, the Coalition of Skin Diseases, referred to as CSD, is near and dear to my heart as well. I'm a board member, and I'm very privileged to be a part of that. I also am a recent chair of their patient or their member association development committee. And we're always looking for involvement of dermatologists and other care providers and just spreading the word. So again, I'm so thankful and happy and thrilled to welcome Kelly Barta, our featured speaker today. Kelly's a little under the weather, so I'm so glad that she's agreed to still come on live with us today and talk about the work of the Coalition of Skin Diseases, which she is president of the board. She is also the executive director. She's just an amazing woman in so many ways. And I feel like I have a pretty high bar for, saying someone is passionate about their job. And I will tell you, Kelly is passionate about her job. She does a great job of just connecting with so many people and organizations and different things that makes the lives of patients better with skin disease. And she knows this personally as someone that has suffered from topical steroid withdrawal syndrome. So I'm just so thrilled to have Kelly here again. She's under the weather, so she's going to be a little blacked out, but she is here and ready to take it away and share her talk with us.
Thank you so much, Alanna. It's an honor to be here with all of you. Thanks for taking time to listen to hear and learn a little bit more about our coalition. I'll give you a bit more background on myself. I'm a patient first, or a person who is living with a skin disease. I was diagnosed with eczema as a young girl, and then went on to manage my skin with topical steroids for 26 years, which led me into what Alanna just mentioned, topical steroid withdrawal syndrome. This is an emerging condition that is very debilitating. It's very protracted, and so it really upends a person's life. So because of my experience going through that, it's really what propelled me into the world of advocacy, because I knew someone had to share the story and get involved to change the way that this was taking place in people's lives, because it's completely preventable. So I started working at that time with the International Topical Steroid Awareness Network, ITSAN. And through my work with ITSAN, I got involved with the CSD. And I started seeing that, there is so much overlap between skin diseases in general, the way that they really affect a person's life and can be extremely debilitating, and cause a lot of burden and suffering. So the more I got to know these different groups, the more I saw, wow, our collective voice together can be so much more powerful than one patient population on its own. And many of the challenges that we faced were similar. So I was really excited about the work of the coalition, and I joined the board of directors, and that led me into the position I hold now as the executive director and the president. And like Alanna said, I am very passionate about this because I personally have experienced how skin diseases and conditions can impact a person's life. And there are so many great needs of this community. And so I love working with our organizations. They are very patient-centric. They're very passionate about what they do, about providing resources and education for patients outside of the clinic. So really, it's a wonderful resource for you as dermatologists to know about, because there's only so much you can do in the clinic, right? Like, you can look at the conditions, you can provide a treatment pathway, but for people to get the kind of support that they need in community, and even bouncing ideas off of each other, or having someone listen who's been there, or if you're a caregiver, it's so, so important. So one of our big goals is raising awareness to the fact that we are here for patients. And so if you have skin patients, let them know about our coalition. There's a place on our website where you can click and see all of our different organizations, and we support anywhere from psoriasis, eczema, vitiligo, alopecia, all the way to the very rare diseases, like some Alanna mentioned earlier. So we really are trying to, pull in every single org that we can, so we have a great representation of the skin community. So Alanna invited me here just to share a little bit about our work, who we are, and how you might be able to get involved. So with that, I'm going to go ahead with my presentation. So the coalition was formed in 2007. We've been around quite a long time, but we really re-identified ourselves and honed in on what we wanted our mission to be and why we existed in 2020. Because prior to that, a lot of our efforts were in support of the American Academy of Dermatology and things that they needed a patient voice in, such as scientific lectures, or when they would go to the Hill and talk to legislators about certain things that they were concerned about. They needed the patient to provide the why. But there was always this tension in amongst our group saying, we see all of these challenges and all of these unmet needs. We want to be able to really have the floor to bring these forward, especially in places like advocacy on Capitol Hill. And so we decided to kind of redefine who we are, what we wanted to do, our programming. We reached out and got some funding, and a couple of years ago, we started having our own Capitol Hill Day, and that has really expanded to more work. So simply said, we exist to ensure that all people living with dermatologic conditions are leading healthy and fulfilled lives. That really is our vision. And our mission is to improve the lives of all people living with dermatologic diseases by uniting patient advocacy organizations and stakeholders in the common goals of advocacy, education, and awareness. So our coalition, I'll just read it here, but it aims to be at the forefront of progress toward a day where all individuals affected by skin disease have access to life-preserving and changing treatments and high-quality care. Sadly, it's not the case today. And we work to accomplish this by fostering education and awareness of skin disease and disorders. We advocate for access to appropriate and quality healthcare and treatments, contributing to burden and related skin disease research, and strengthening our patient advocacy organizations through the sharing of resources. So we really have three big pillars. It's advocacy and really raising awareness of the burden and the impact of skin disease. It's really promoting research through asking for funding around that and doing what we can as patient organizations to gather data ourselves as the larger dermatology patient community. And then also strengthening our groups, because we've got some orgs that have been around for 30 years and they're doing amazing things. They've got a large staff and a lot of revenue. We have other groups that are very, very small, run by a volunteer patient, and they need a lot of help. And we really believe the more that we can help each other, share resources, the more we can collectively do to impact the whole health system as far as dermatology is concerned. So you can see here a lot of the logos of those groups that are a part of us. We're mostly patient advocacy organizations, but we also have affiliate organizations such as the American Academy of Dermatology, the Society for Investigative Dermatology, the Dermacare Access Research Network, the Skin of Color Society. So we're working with professionals as well, because we realize that when we go forward, especially around advocacy or working on different projects, when you bring the patient and the provider voice together, it is so much more powerful and so much more insightful. So we see that that partnership is extremely valuable, and we really want to foster that within our coalition. We also realize the importance of strategic relationships. And so I've listed a couple here that we are a part of, just so that we can have our ear on the ground of what's happening in the derm space, but also that we can be a voice at the table and make sure that patients are being represented in any conversation where decisions are happening around research, around health technology assessment, around regulation of drugs, research and development, all of these things. So we're part of the NIAMS Coalition, or the National Institute of Arthritis, Musculoskeletal, and Skin Disease. I sit on the FDA and CTTI Patient Engagement Collaborative. So this is one of the ways that patients can get involved to inform the FDA on certain different aspects of their work. We're a part of the Ad Hoc Group for Medical Research, the Center for Innovation and Value Research, Patient Advisory Council. So I also sit on that council. And this is all around health technology assessment and really trying to find the value of drugs and how they affect the patient community. The International Dermatology Outcome Measures, it's so important to make sure that we have the patient's perspective in developing measurements. Friends of NIEHS, which is the National Institute of Environmental Health Sciences. And this is a really important one because I see a lot of our immune-mediated diseases as the canary in the coal mine, really what's happening in our environment with a lot of the chemicals that we're exposed to and the foods, and just all of these different environmental factors are driving a lot of these immune conditions. So even though we're developing a lot of medications to tamp down immune response, it's extremely important that we're finding the root causes and addressing those. So that's something I'm personally very passionate about, because that's my history as well. And then, of course, the generic access projects and others. So I didn't list them all, but here are just a few of groups that we work with. So I also wanted to take you into a deep dive into our legislative agenda. This is for the past 118th Congress, and really a lot of our priorities will remain similar, because we've seen year over year, many of these issues are those that all of us are bumping up against in our patient communities. So top of the list would be patient access issues, and this would be to appropriate care and treatments. There's a lot of insurance protocols that get in the way of people being able to access medicines. And a lot of patients have experienced this, but they don't know the terms around them. So I know one of our big goals is to help demystify all of these insurance protocols and let people understand, listen, it doesn't need to be this way. These barriers don't have to exist, and it takes you raising your voice and stepping up to talk to legislators and policymakers about these things so that they change. So one of the top issues is step therapy reform. And if you're familiar with step therapy or fail first, it's when an insurance company will require a patient to step through certain medications that are less expensive before they will cover another medication if it's more expensive, even if that's what the doctor has prescribed. And so the Safe Step Act legislation, I'll read here off the slide, would require insurers to implement a clear and transparent process for a patient or healthcare provider to request an exception to this protocol, and requires group health plans to grant exceptions if certain protocol is met. So this would mean that instead of weeks to months of delays, these insurance companies would have to give an answer within 72 hours. So if a request is made, they need to reply in 72 hours, and they need to grant exceptions if the doctor says, this is what I really recommend for this patient. They have failed this other treatment. It doesn't make any sense. They've been on this treatment already, and just because their insurance has changed, it doesn't mean that they have to go through all of these other cheaper medications. So it just really is common sense guardrails around this protocol. So that's one top issue. We actually have been working on this for several years now. It's amazing how long these things take, but we're still beating the drum and hoping that this gets passed in the next year or two. Another issue that's close to our hearts is banning a copay accumulator programs. And if you haven't heard of these before, this is a new protocol that insurance companies are implementing into their policies. In the past, a lot of times manufacturers will provide coupons to help cover the cost of certain drugs that are, especially around biologics and some of these drugs that cost a whole lot of money. They will give the patient a card that they can use. And then once that amount is used up, a lot of times that person's deductible kicks in, or has been used too, and then their insurance will cover it. Well, what's been happening is these companies have changed their protocols so that they will take the manufacturer's money, but then once it runs out, they'll tell the patient, well, now you need to meet your deductible on this, and then they'll have to, cover the cost again. So they're basically double dipping, which when patients hear this too, it's extremely maddening, because they're used to being able to have these drugs covered, and they'll come up to the pharmacy after 3 months into the year and all of a sudden be hit with this enormous bill that there's no way that they can cover, just completely by surprise. So this Help Copays Act is a piece of legislation, and it closes a loophole that allows many employer health plans to deem certain covered drugs as non-essential, which means that the insurer will not count any cost sharing, and that's that coupon, toward the patient's deductible and out-of-pocket maximum. So this bill will require all private plans to count these cost-sharing covered services into the deductible for the patient. So it will remain as it was in the past. So this, again, is another one of those pieces of legislation that's just common sense. And it's really maddening, the more you learn about these things, that once one problem is fixed, it seems like they find another thing to throw onto patients to make it harder for them to access these expensive drugs. And of course, it makes sense when we're living in a world that, money matters, and they are thinking about it as a business. We understand why these things take place, that these are cost-saving measures for the insurance companies, but at the end of the day, it's the patients who are really suffering because of these things. And so that's why it's so important for us to raise our voice and tell these legislators what's happening real time in our lives and what we're experiencing. So another piece of legislation that we supported this past year is the Protect for Rare Act, and it's providing realistic opportunity to equal and comparable treatment for Rare Act. It's kind of a long one, but it provides coverage under the Medicare prescription drug benefit, Medicaid, and private health insurance of certain drugs that are used to treat rare conditions or diseases. So this is all around off-label use, and a lot of times, insurance companies, if it's not on their formulary, which is the list of drugs that they cover, for a certain disease state, they'll say, sorry, we're not going to cover that. But we all know that certain drugs are, in literature through different trials have been proven to be effective for some of these rare conditions. They just have not been put on the indication as of yet. So this piece of legislation will help allow doctors to really make that ultimate decision on off-label usage. So it's not just for rare. This really would affect so many more than the rare community. Lastly, the issue that we brought up this past year was around pharmacy benefit manager transparency. And if you have not heard of this group, which they're basically the middlemen between manufacturers and insurance companies, they're the price negotiators around drugs. They were set up in the past to lower drug costs, but in fact, over time have really risen drug prices because of all of these closed door negotiations they make and all of these sneaky little tricky things that they do around trying to get as much money as they can turning a profit. And really, again, just like in these other cases that we've talked about, the patients are the ones who are ending up suffering, paying very, very high prices. And so these companies are landing on Forbes 500, making the most money in the United States. Um, and actually, the Federal Trade Commission just launched an investigation this past year into these pharmacy benefit managers and trying to figure out, what's actually happening behind those closed doors. You need to be giving these rebates that you're, negotiating with these manufacturers back to the patients, not to the, yourselves in many cases. So what the Pharmacy Benefit Manager Transparency Act does is it bans deceptive, unfair pricing schemes, prohibits arbitrary clawbacks of payments made to pharmacies, and requires these PBMs to report to the FTC how much money they make through spread pricing and pharmacy fees. So again, this is in hopes of lowering drug prices and really just stopping the racket that's happening in the system around this. And so we understand that all of these different pieces is all like an ecosystem. They all affect one another. But if you look at the US in comparison to many other countries around the world, things are just out of control as far as drug pricing goes. And so we as patients are trying to really step in and step up and tell the story and help bring these companies into accountability. So another big focus that we have is around funding for medical research. We usually get a lot of support from legislators around this, but we're specifically asking that more money goes to NIAMS, which is the institute there that focuses on skin disease. And it's actually very surprising how little funding goes towards skin disease when over a quarter of the population is dealing with a skin condition. So here you can see we requested an increase to 51.3 billion for the year 2024, which includes an increase to NIAMS. But our focus is really when we go to the Hill to talk to these legislators, listen, so many people are affected by these conditions, and it's important that we understand them, not only to really realize what the mechanisms of action are, but real treatments to help these patients. So lastly, we asked for funding around education and awareness. And the CDC has a program called the Chronic Disease Education and Awareness Program. And this is a program where a lot of our patient groups can actually apply for grants to create the material that the CDC will help push out. So it's kind of a partnership here. And then the more money that the CDC gets from the government, the more grants that they can give out. And it really is an incentive for these patient groups to provide the materials along with dermatologists, like Alanna said, like yourselves, to create this material to really help people learn how to prevent and how to manage chronic diseases. So it's a great program. So I want to extend an invitation to all of you to advocate with us on the Hill. Like I mentioned before, it is so powerful when patients and physicians lock arms and go to the Hill, telling the same story essentially, but from different angles. There's nothing like that when we go with our friends who are physicians, nurses, students who are in med school, learning about dermatology, when we can all go and say, hey, this is such an important issue. This is why you need to care. This is how you can address these problems, offering solutions. We go every year in the spring. This next year, it will be May 18 through 20. So if you're interested, please reach out to Alanna and she will connect you with us. We offer some scholarships to get people out there, but we're trying to grow this program year over year because we realize, again, if we represent 84 million Americans, we need to have at least several hundred being, showing up at the Hill, talking to our policymakers about what these patients need. So I just want to thank you all for being so incredible. Thank you for choosing dermatology. Thank you for learning about these conditions and your compassion and your care for your patients. You make our skin world a better place. And with that, I will stop my share.
Ah, Kelly, that was so good. Yay! That was amazing. So good. I'm so excited. I'm so glad to be a part of the CSD, and I'm just excited. The main reason that I do this teaching webcast and the reason I do T4 is, I do think that our young physicians and medical students, they're clearly the future of pediatric dermatology, and I do think that they are going to change the world and make it a better place, even more so for patients as we move.
Absolutely.
Yeah, yeah. So it definitely gives me, hope for the future, excitement for the future. And I do see, a lot of passion from this next generation of dermatologists. So I'm excited
Mhm.
to have them included in some of the work at the CSD. I know the AADA has their legislative conference and they have different agenda items, but
Mhm.
ours, both are important, right? Both
Yes.
important. And again, we focus a little bit more on the patient care aspect. And as everybody knows as well, Made a Masterpiece is another hat that I wear. And the patient voice is very important to me too, and supporting the whole person, which includes all of these things that we advocate for with the CSD. Um,
Mhm.
so again, so many ways that we can be better together, collaborate, and really come together to, again, help the 84 million people living with skin disease. And I
Mhm.
so agree. If our learners here today don't know about prior authorizations yet, because they haven't done a lot of them, they will soon know when they become practicing physicians.
Mhm.
Because that definitely took a lot of my time filling out the paperwork, sending it in, sending it back with more information, um, doing peer-to-peers. It's a time-consuming process on our end. It's a time-consuming process on the patient end, and there really is
Mhm.
no reason for it. And I always say the Step Therapy Act, what it does is it allows medical insurance providers that don't know how to pronounce the names of diseases half the time, um,
Mhm.
certainly not know about what the treatment is, or appropriate treatments are, um, and basically just go off an algorithm. And they are basically practicing medicine. They are taking
Mhm.
that control out of our hands as physicians and patients in the patient physician relationship. And they're basically practicing medicine by telling us what our patients must be prescribed. And they don't know what the side effects of these medicines might be or why they are contraindicated. And even if you try to explain that, sometimes it just doesn't make a difference because they just go off their algorithm.
Mhm.
So it's just so highly frustrating. So yes, I love that's one of our advocacy things that we push for. So yeah, definitely impacts people on all of these on all sides
Mhm.
of it. And I did give a little short talk on May 28th that's in our archives for T4. It was called CSD on the Hill. And in that presentation, I did share a website where you can find who your elected officials are. And I know we're working to kind of increase our resources online. And I know that, that's something that we might be able to do is put what our asks are each year on our website and share that with the medical community so that they can reach out on our behalf too, because the more
Mhm.
we raise our voice together, the better off we can be. So we might be able to get a little one pager together, and I can certainly share that with the SAGES T4 community. But again, it's in my lecture, but the link is https www.usa.gov/ and then elected dash officials. And you can type in your zip code, your address, and it'll tell you who all your local, state, and national representatives are. So you can reach out to them about these acts as well and join us in raising our voice. So again,
Yeah. I would
yeah.
just love to add, yeah, it's so important that we are connecting with our elected officials. We have an amazing system set up in the United States that not a lot of countries have, but so few people engage in really making a difference and advocating on behalf of the people who they care about. So it's not hard to do. I remember the very first time I reached out to my state senator, he was telling me, you'd be surprised at how little people get involved in work like this. And I thought in my mind, well, I'm sure I know because it never crossed my mind until I really started caring about this. And I was just racking my brain thinking, what can I do to make a difference? Well, if the people we need to care aren't caring, we need to go to those in authority. That's just who our legislators and our policymakers are. So you just make the call, gather your strength, be the brave person, make a phone call. It's just a human on the other side, right, of the telephone. You set up an appointment with them and they're just a regular human. They're like your neighbor or your uncle or your aunt. You just meet with them, tell them the things that you care about, and they're there to represent you. You know, they're in a public office to serve us. And I think sometimes we forget about that, that we have to be a part of the system if they're there serving us. It's not just a couple people running the show like puppet masters. We really need to engage. So that's what I love to do as someone in the coalition, because in the past I was given that gift of advocacy. And once that light turns on, like, wow, we really can make a difference about these in these different issues just by showing up and being a warm body in the room or sending a letter or having a conversation. These are the people who will be voting on these things to really help patients instead of it being in the best interest of the insurance companies or those who are in it for profit. They're doing it on behalf of the people who are suffering and really need their help. Everyone wants to be a hero, right? So if we can help them make those good decisions, all the better for it. And I just wanted to add to before we sign off. I wanted to say just a big thank you for those of you who have gone into medicine. You have a unique role to really impact a person's life for the good. And I know there's a lot of burnout happening in medicine. You guys give so much, and it's a hard system to work in. But as a patient, I just want to say I remember every single one of those people in my who were part of my care team who actually saw me, who took time to really connect and care for me and give me time. Alanna, I know you are definitely that type of a person who looks at the whole body, right? Not just a piece of flesh and meat that you're treating, but you're looking at the person and the soul inside. That is so important because we need hope. We need a reason to live. We need someone who cares about us. So I just want to thank all of you who have chosen this profession. For what you're doing, and just want to honor you for the work that you do. So thank you.
Kelly, that's so wonderful and such a great way to end, because yes, we all need to help fill each other's cups of compassion so that we can pour out more and more. So thank you for doing that. Thank you for being a part of T4, for launching our T4 P2 series with
Yeah,
me today. Such an
my
honor
pleasure.
to have done that with you. And I know that we're going to continue to do great things together, CSD on the Hill. And I
Yes.
know that we're going to be joined by all these young learners doing the same. So I did put the link in the chat about how to find your elected officials and advocate with us.
Right.
So again, thank you, Kelly. Thank you for all our learners, and we will see you next time.